Welcome to the E.WE Foundation's Health Equity Community Workshop. I am the Foundation's CEO and President, Sarita Edwards. Recognizing the unique challenges that rare disease patients face and working towards eliminating disparities is crucial to ensuring that all individuals, regardless of their condition or background, have equal access to timely diagnosis, effective treatments, and supportive resources. The Health Equity Community Workshop is an organized event designed to educate, engage, and empower participants on the concept of health equity and its significance on rare diseases. The lead presenter today is Vivian Duong, MPH student at the University of Pittsburgh School of Public Health and E.WE Foundation 2023 Summer Intern. Our goal for today's workshop is to increase your awareness about health disparities, social determinants of health, and the factors that contribute to unequal access to health care and positive healthcare outcomes. Thank you so much for being here.
Thank you for tuning in to the E.WE Foundation's Health Equity Community Workshop. To learn more about our health equity initiatives, visit our website at www.thewefoundation.org/healthequity. To receive the continuing education credit for this course, scan the assessment QR code on the screen. Upon successful completion of the assessment, you will receive your continuing education credits by email. Now, let's get started.
Hello and welcome. Thank you for joining today's presentation as we embark on an introductory exploration of health equity, and its implications in the context of rare disease. Before we delve into our discussion, it is crucial to recognize that health is a shared experience, reciprocally influenced by the individual and the community. It is the choices we make, the environments we inhabit, and the resources available to us that collectively shape the overall health landscape. Moreover, health is a holistic concept that encompasses physical, mental, social, and environmental well-being. By acknowledging the interplay among these different dimensions, we lay the foundation for a more inclusive and comprehensive approach to healthcare that addresses the diverse needs of individuals and communities alike. Our collective well-being hinges on the principle of health equity, a commitment to ensuring that every individual, regardless of their background or circumstance, has a fair and just opportunity to obtain their highest level of health. As we stand at the intersection of advancements in healthcare, technology, and societal awareness, the urgency to address health equity in the context of rare diseases becomes increasingly apparent. Individually rare, but collectively common, rare disease presents unique challenges, from delayed diagnosis to limited and often expensive treatment options. Our presentation today will serve a dual purpose. Firstly, we aim to define and demystify terms integral to our understanding of health equity, and rare disease, as understanding this language is pivotal in laying the groundwork for informed discussion. Secondly, armed with these concepts, we hope that by session's end, you'll begin to utilize these tools to critically examine healthcare, dismantle barriers, and foster a more inclusive environment. Whether you're a healthcare professional, a policymaker, an individual living with rare disease, or simply an individual passionate about making a positive impact, this conversation is for you. As we embark on this exploration together, I encourage you to engage and reflect on how we can collectively contribute towards a healthier and more equitable future. Thank you for your attention, and I hope you find this presentation both insightful and enjoyable.
Hello, and welcome to the Health Equity for Rare Diseases workshop. My name is Vivian Duong. I'll be presenting this workshop today, and I'm super excited to share this with you. A little bit about me. I'm a second-year MPH in Human Genetics student at the University of Pittsburgh. I'm also pursuing a graduate certificate in health equity, and so this is a topic that I'm very knowledgeable and passionate about, and so super excited to share this with you. So before I start presenting the workshop, I just wanted to go over some objectives for this workshop. I'll be defining key concepts, including health equity and its significance in the broader healthcare and public health landscape, differentiating health equity from other terms like equality and disparity, which are often confused with health equity, explaining the relationship between health inequities, health disparities, and social determinants of health, describing intersectionality and its role in power and privilege, examining the unique challenges faced by patients and families living with rare diseases, and finally, identifying goals and strategies for achieving health equity for rare diseases. And so this workshop is divided up into 3 sections. The first section is just an overview about health and its determinants. And so before I talk more about what is health equity and why it's important, I wanted to first make sure that we're all on the same page about what is health. And so this is a definition taken from WHO, the World Health Organization. They define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I think this is a really important distinction to make because oftentimes when we talk about health, we're always looking at health problems or diseases, and that's not always the case. And so I just wanted to share this with you. And I also really like this graphic here that really nicely shows the 3 components of health. Next, I want to talk a little bit about what is public health. So public health is defined as the science of preventing disease and improving the health of all people and their communities through the organized efforts of society, organizations, and people. And so public health is different from healthcare in that public health is focused on the health of larger populations, while healthcare is oftentimes very individualized and focused on a single patient or patient's family. And so how we achieve public health, there's 3 components here, as you can see in this pie diagram. These components are assessment, policy development, and assurance. I won't go into too much detail about what each of these means, but I wanted to include this here just to give you kind of an idea of what public health is, and also let you know that all of public health is really centered around this concept of equity. Next, I want to talk a little bit about the social determinants of health, and these are really important for understanding health equity. They're defined as the conditions in the environments where people live, study, work, etc., that affect a wide range of quality of life and health, risk, and outcomes. And so there are 5 social determinants of health. I'm going to talk a little bit about each one individually. And so I've listed out under each determinant kind of what are the different characteristics of each of these, because this is by no means a comprehensive list. And so these are just kind of to help give you an idea of what each of these determinants means. And so the first social determinant of health is economic stability. When we're talking about this determinant, we're looking at things like employment, whether or not somebody has a job, is able to keep a job and make a living that way. Income level, this can also include poverty and just like how much money they're making or their household is making altogether. Expenses, this is looking at how much they're paying each month, and this can vary on a lot of different terms such as where they live or how many mouths they have to feed, things like that. And then finally, debt. So debt can come from, personal expenses like school, or it can also be inherited. And so all of these things can be a really big burden for people trying to achieve economic stability. The second determinant is education access and quality. And so under this category, I have literacy, which is being able to understand and comprehend information being presented. And so this can be impacted by things like education level and also like language barrier, which is something else that I have listed here, whether or not they're even able to understand the language, that can also contribute to access to education. And then something that's especially important for rare disease patients, I wanted to talk a little bit about early childhood education, including special education programs. Oftentimes, because of the unique needs of rare disease patients, they require some additional special education. And so making sure that these patients have access to this in their local communities and schools is really, really important. And then finally, higher education, whether or not somebody has a college degree or goes to college or even higher than that, such as graduate education. These are all factors related to education. The third social determinant of health that I have here is healthcare access and quality. This is probably the one that we're most concerned about when it comes to talking about rare diseases, especially looking at cost of care. Specialized care for rare diseases can become very, very expensive. And then also considering healthcare coverage, it can be especially difficult for some of these patients and families to receive coverage for their care. And so this is an important factor that affects healthcare access and quality. The second thing that I have here is provider availability. And so this can be as a result of a lot of different things, whether or not patients are able to find the providers that they need, especially when it comes to more specialized care. Also looking at just where they live, if there are even providers of that specialty in their area, things like that, or just like being able to schedule an appointment with specialists sometimes can be really, really challenging. And then the next thing I have under this category is provider linguistic and cultural competency. And so this is just this means the capability of providers to provide culturally competent care. And so that means that this requires providers to have an awareness about some social and cultural barriers that patients might have as they're navigating the healthcare system. And so this can really, really impact, especially the quality of care that patients are receiving. And then the fourth category here that I have is neighborhood and physical environment. And so the first thing that we really think about when we think about neighborhood is about housing, whether or not somebody has stable housing or not. Transportation, this can mean access to public transit lines, or it can mean whether or not somebody has a vehicle and is able to get around. This can be a really, really important factor, especially when it comes to accessing healthcare and education. It's just whether or not they're able to get to the places that they need. Another thing when it comes to neighborhood is looking at safety of the neighborhood, looking at crime rates. This can be really, really impactful to somebody's health. In addition, we also have rurality and geography. So just looking at where they live. Sometimes in more rural communities, it can be really, really challenging for patients to go to appointments, go to school, things like that, especially if they have to drive much longer distances. And then on top of things like work and other commitments, it can be really, really challenging for patients to receive the care that they need. And then finally, food security. So this can also factor into whether or not they have, grocery stores, convenience stores where they can get healthy food in the area is really, really important, but also being able to afford healthy food can also be a challenge. And finally, the fifth social determinant of health is social and community context. And so this looks at a lot of different things within the community. The first being social integration, whether or not they are able to integrate into society, make friends and connections. This can be especially challenging for patients with rare diseases or other conditions where they have certain social challenges, behavioral challenges. And so this is why it's really, really important that we're able to support these patients and families. And so some patients are lucky enough to have support from family and caregivers, but other times, they may rely more heavily on community support groups. And so this is another consideration with this determinant. Whether or not participants are able to engage in the community, this is an important factor as well, because this can really, really impact things like quality of life and health. And then finally, social stigma and discrimination, whether this is based on race, ethnicity, or a number of other different types of identities, is really, really important and can be really harmful to a person's health as well. And so now that I've given you a little bit more information about what each of these social determinants of health is, I want to talk a little bit about how they can impact health outcomes. And so when we think about health outcomes, oftentimes the first things that we think about are mortality and morbidity rates. And so looking at um, how many people are passing from a certain condition or health problem, and also some morbidities that are impacting people with this condition are really, really important. But also, I think it's really, really important to look at quality of life and life expectancy. So whether or not um, patients are having good quality of life, or if their condition really, really impacts their personal experiences. And especially with rare diseases, healthcare costs can become quite significant. I'll talk a little bit more about this later, but this can be a huge, huge burden for people and can prevent them from getting the healthcare that they need. And then finally, functional limitations. There are 6 different kinds of functional limitations that can impact people. The first being vision, whether or not people can see can be a really significant factor, whether or not they can get around and be successful in life. Hearing, whether or not they can hear. Mobility, just being able to physically move around spaces can be really important. um, Communication. So when we talk about communication, it's not just whether or not people can speak with each other, but also if they can understand each other appropriately is a really, really important, especially when it comes to making healthcare decisions. Cognition. Cognition looks at how people think, but also their learning and their memory can be impacted by functional limitations in cognition. And then finally, self care, whether or not patients can take care of themselves or if they're reliant on a family member or a caregiver to help them. These are all important things to think about when we look at health outcomes. And so now that I've given you some context about health and its determinants, I want to give a little overview about what is health equity. But before we go into what is health equity, I want to distinguish the differences between equity and equality. These are two terms that are really, really easy to confuse. And so I really like this tree graphic here. I think it does a really, really nice job of showing the differences between these two concepts. So equality is basically means sameness. And so as you can see on the left side of this graphic, all 3 of these individuals have the same number of boxes that they're standing on, but there's an imbalance in who can actually reach the fruits on the trees. And so this is where we have an inequity issue. So even though everyone has the same resources, not everyone has the same ability to reach the tree. But when you look at equity on the right side of this tree graphic, you can see, while everyone has different numbers of boxes that they're standing on, they're all able to reach the fruits on the tree. I think this is really important when we talk about equity, and access is ensuring equitable access to whatever it is that patients might need. And so in this case, they all have equitable access to the fruits on the trees. And so I really, really like this graphic for this. But yeah, as you can see, when it comes to inequity, there is a justice component. So inequity can be due to systemic conditions and policies or imbalances in political power. And so when we talk about health equity, our goal is to reduce and eliminate health differences that systematically favor advantaged groups. And so now that I've talked a little bit about health equity and hopefully given you some more terminology there, I want to also talk a little bit about health disparity. This is something that is often, again, confused with health inequity. And so when we're talking about health disparity, it's quite literally a difference in health outcomes between populations. And so health disparities are really, really easy to observe and measure. It's very easy to look at two different populations and say, okay, population A has a higher rate of X disease than population B. But that doesn't tell us, why this difference occurs and how we can address this difference. And so that's where we get into health inequity. This is where things get a little bit more interesting. And so health inequity is different in that it is looking at, again, an unjust difference in health outcomes as a result of systemic social and economic conditions. And so when we look at health inequities, we can start exploring some of these conditions to see, what is preventing communities from accessing conditions that allow them to achieve their full potential. And that's really the goal of health equity initiatives, is to ensure that everyone from all different communities is able to, access whatever it is that they need. And so now that you have more terminology about that, I also want to introduce this term called intersectionality. So intersectionality means the intersection of different social identities such as race, ethnicity, gender, class, etc. There's a whole bunch of them listed on the side here. To create overlapping discrimination and privilege for disadvantaged individuals and groups. And so as you can see in this diagram on the left here, these different identities can all overlap, intersect to create different types of discrimination and privilege. And I have some examples of what this can look like here. The first example that I have is housing segregation based on race and ethnicity. While this is something that is slowly improving, this is still a big issue, especially for African American communities that are trying to find housing. And so, as you can see, this is an overlap between housing and race and ethnicity. The income gap between men and women is another very classic example of this. And again, while it is getting better, it is still an issue to be discussed. And this is, again, intersection between income level and gender. Women oftentimes have lower or receive a lower income than men for the same positions. So this is another issue of discrimination here. And then the third example that I have is poor quality of care due to literacy problems or language barriers. This is the problem that we're beginning to address through things like medical interpreters, but also diversifying our healthcare workforce with more people with multilingual backgrounds. But unfortunately, this is still a big issue. When you're not able to understand your patients or your providers, this can really result in poor quality of care. And so this is something else that can happen as a result of intersecting issues. Now, I mentioned the word privilege in the last couple slides, and so I just wanted to define privilege here because I know this could be a term that people might recognize, but they might not fully understand. And so I just wanted to define this here in plain words for everyone. So privilege is defined as the advantages held by a group in power or in a majority due to the oppression of minority groups. And so this doesn't mean that somebody with privilege is actively oppressing other groups. This is just something that can sometimes happen as a result of the oppression of minority groups. And there are many, many, many different types of privilege. The most talked about one, especially in more recent years, is white privilege. And so white privilege is defined as the advantages held by white people based on their race over non-white people. And I really like this quote here that talks about white privilege. It states, "White privilege doesn't mean your life hasn't been hard. It means the color of your skin isn't one of the things making it harder." And I think this is a really important distinction to make, because I think oftentimes people feel like when you tell them, oh, you have white privilege or some other type of privilege, they might get offended or think like, oh, they're trying to tell me like I didn't earn something. But that's definitely not the case at all. And I also like this second quote. I think they really, really define this in a very nice way. They say some people have a hard time recognizing privilege, saying, I work hard, I don't get things handed to me, and I understand that. Here's how I respond. Privilege isn't bonus points for you and your team. It's unfair penalties the other team gets that you don't. And so, again, talking about how it is not, you know, like we're not saying you didn't work hard for what you have or that you didn't earn it. It's just like, as she said, it's the absence of obstacles and barriers. And so this can be a lot harder to notice. And they say if you have a hard time recognizing your privileges, focus on what you don't have to go through. Let that fuel your empathy and action. And so there are a lot of different kinds of privilege. Everyone has some kind of privilege, but some of them just might be harder to recognize. And so I think just being aware that this is something that we all have in some aspect of our lives is really, really important. Which leads me to this activity. This is an optional activity, but I wanted to share this because I think it's really, really, really great activity for looking at power and privilege. It's called the Wheel of Power and Privilege. This is a reflective activity to map issues of power and privilege in an intersectional way. And it can be used to highlight how different people might be privileged or marginalized by systems in our society. And so as you can see here, it's like a pie, and each slice of the pie has a different type of identity. Of course, there are a myriad other different types of identities that you can have, but I think this has a nice variety of different types of identities that you can have. And so if you want to complete this activity, it's super, super easy. I have a link here and you can go do it on your own. But I really, really like this activity because it's a really nice visual for seeing your different identities and kind of where you fall in terms of privilege and marginalization. And if you decide to do this activity, I also have some discussion questions here that you could use to kind of guide your reflection as you're doing this activity. The first being, how did you feel before, during, and after the activity? What did you learn about yourself, about power and privilege? And were you surprised by anything while doing the activity? And so if you like this activity or like these discussion questions, feel free to let us know in the evaluation at the end of this course. All right. The last section that I have here for you is health equity for rare diseases. So now that I've given an introduction about what is health equity, we're going to be talking more specifically about health equity for rare diseases. And so before I go too much into this issue, I want to first define what is a rare disease. So there are a lot of different kinds of definitions for rare diseases. In the United States, we define rare diseases according to the Orphan Drug Act as a disease or condition that impacts fewer than 200,000 people. And there are more than 10,000 known rare diseases that affect about 1 in 10 people or 30 million people in the US. And we are constantly learning more and more about rare diseases every single day. Other countries have similar but slightly different definitions. For example, the European Union defines a rare disease as impacting fewer than 1 in 2,000 people. But there are over 300 million people with rare diseases worldwide. And so, looking at individual statistics, while they may be individually rare, across the globe, rare diseases are collectively common. And I really like this quote on the side, or this analogy. Oftentimes when we hear hoofbeats, we think horses, but sometimes it's a zebra. And so this analogy is used to describe kind of the difficulty when it comes to detecting rare diseases, especially among healthcare providers that are just not aware or not knowledgeable about some of these conditions. It can be really, really easy to, diagnose as a horse rather than a zebra because they are so rare. And so I'll talk a little bit more about some of those issues in this section. Rare diseases are often chronic, progressive, and degenerative. They may cause disability and are frequently life-threatening. Oftentimes, these can be very terminal conditions, and so this is something to think about when we're talking about rare diseases. 72% of rare diseases are genetic, and 70% start in childhood. And so this is why there's a huge concern for rare diseases in our younger populations and our children, and why it's really important to have things like special education programs in place for these patients. And finally, most rare diseases have no cure and few treatment options. In fact, only 5% have an FDA-approved treatment. And so a lot of times with rare diseases, treatment is really centered around management of the disease and symptoms and not focused on finding a cure. And especially because it can take a very, very long time for a patient with rare disease to get an accurate diagnosis. And this leads me to the cost of care for rare diseases. This is a graphic made by the NIH, and they did a study looking at the costs for rare diseases. As you can see here, individual costs for people with rare diseases are 3 to 5 times greater than for those who do not have a rare disease. So this can get very, very expensive. Yearly costs are estimated at around $400 billion, which is similar to those with cancer, heart failure, and Alzheimer's disease. And a lot of these conditions here that they're being compared to are older onset conditions. And so when we talk about rare diseases, this is really something that has an onset in young children. And so this is a huge, huge concern because it can get so expensive and because this is a condition that is often chronic and lasting their whole life. This is a huge, huge burden for patients and families with rare diseases. It's just the cost of care. And so this leads me to, how do we achieve equity for rare diseases? How do we improve some of these issues here? I think the 3 things that I really want to talk about when it comes to equity for rare diseases are first, social opportunity, the opportunity for patients to, engage in society, to make friends, to build connection. This is a really, really important aspect that I think we don't talk about enough. But, even though they have rare conditions, people with these conditions still need things like this in their personal and social life. The second thing here is non-discrimination in education and employment. This is, a really, really challenging issue. Oftentimes, people with rare diseases, as mentioned previously, require special education or some additional accommodations in schools and workplaces, and that can really inhibit their opportunities to pursue these things. And so just ensuring that we're not discriminating in these 2 spaces and that we're promoting accessible and equal opportunity for rare disease patients is really, really important for them to be able to pursue education and employment. And finally, equitable access to healthcare, which includes diagnosis and treatment and management, is going to be really, really important for people with rare diseases because they require so much specialized care and because finding a diagnosis can take several years, and even because things like treatment and management can be chronic, can be regular, and something that they need for long periods of time. These are all really, really important to ensuring that they have equitable opportunities to realize their full potential. And so I wanted to show this video here. I really like this video because it shares some stories from rare disease patients and families about their experiences um, and yeah, their search for answers essentially. Some of the statistics are a little bit outdated, but I think the stories are still very relevant. And so I hope you enjoy.
You would never know that there was something wrong. They had found the NPC, Niemann-Pick type C, a fatal genetic disorder.
They told us that she had hypoplastic left heart. The left side of the heart didn't develop. Essentially, she had half a heart.
We were told that they were 2 of 5 people in the whole United States that have it. They do not produce any leptin.
There are approximately 7,000 rare diseases. 50% of them affect kids.
She will lose all neurological functions. She'll lose the ability to talk, to swallow. She'll lose the ability to walk. It's terrifying.
It's heartbreaking.
It just hit us hard emotionally and kind of scary. You got to leave it up to the doctors to take care of this heart condition.
Not knowing what your child has and going to all the doctor's appointments over and over and over again and not getting anywhere, you want to give up.
While a single rare disease may only affect a handful of people, altogether more than 25 million Americans have a rare disease.
There's no hope without research. There's a lot of really cool things in the works between the trials, and there's gene therapy going on that looks really promising.
Not only gives new answers in terms of specific diagnosis to kids, but also creates the information base that we need to develop therapies for these diseases, most of which don't have any existing treatments for.
Knowing the answer really helped. Makes it a lot easier to explain to people. Makes it a lot easier for school. Makes it a lot easier on my mental health and other stuff.
Our biggest hope is that the science is quicker than the disease progression. She would not be getting the treatment she's getting now if the research wasn't done 10 years ago, 20 years ago. I always like to think too, diabetes, before all that study was done, people were dying from it. And now there's a treatment and it's manageable.
So I really, really like this video. Again, I think it gives a lot of really great insights into what these patients and families experience, and tells a little bit about kind of their healthcare journey and their journeys navigating school and mental health and things like that. All right. And so this leads me to, now that we're aware about some of these equity issues, how can we advocate for patients and families living with rare diseases? And so I've divided this section up into 4 categories. The first being education and awareness, followed by healthcare services, research and policy, and finally, patient and family support. And so under education and awareness, I think it's really important to emphasize that it's really, really important first just to increase awareness about the existence of rare diseases and how they impact people and families. And so this is important not just for healthcare and public health professionals, but also just the general public, just making people more aware that this is an important public health problem. And, these awareness efforts also need to include things about social stigma and discrimination faced by these individuals with rare diseases, so that we can also make sure that we're reducing bias and stereotypes that these patients might face. Another thing is just improving the knowledge and understanding of rare diseases by implementing educational programs in medical schools and healthcare institutions. And this is really important just to ensure that our future providers are much more aware about these conditions so that they can identify it earlier on and that they're accurately diagnosing these patients. And so one way that we can improve the understanding of rare diseases is by sharing personal stories and experiences to humanize the challenges faced by those living with rare diseases, such as through the video that I just showed you. But there are also a lot of other really great resources out there of people sharing their stories with rare diseases. The next one I want to talk about is healthcare services. And so this is divided actually into kind of three categories here. The first, when it comes to healthcare services, is promoting early detection and prevention. And so when we advocate for increased awareness and education among healthcare professionals, this can make really great progress in reducing diagnostic delays for people with rare diseases. If especially healthcare professionals are more aware about these conditions, then they can more accurately diagnose them. In addition, supporting newborn screening programs for early detection can help enable more timely intervention for rare diseases. Newborn screening programs are really great public health genetics programs that all newborns go through when they're born. And there's a bunch of rare genetic conditions that are listed on these panels. And the panels vary slightly by state, but generally they all have really important genetic conditions on there that, if identified in newborns early, can be really, really impactful for improving their health outcomes. And so, yeah, if you want to learn more about newborn screening, you should check out your state newborn screening program to see kind of what conditions are available there. The next thing I want to talk about is access to specialized care. As mentioned previously, patients with rare diseases often require very specialized care for their condition, and this can mean they need multiple different providers or they seek care at multiple different institutions. And so just ensuring equitable access to these specialized healthcare services as well as providers can be really, really important to ensuring that these patients receive the care that they need. One great example of a specialized provider that can be really, really helpful for patients with rare diseases are genetic counselors. Genetic counselors are uniquely equipped with both the genetics knowledge as well as psychosocial counseling skills to discuss rare conditions with their patients, including some of the psychosocial and familial implications of these diseases. And so they are a really, really great resource if we can ensure access to them for all patients. And one way we can improve access to genetic counselors and other providers is through telehealth. Telehealth has become a really, really great medium in more recent years, especially in the wake of COVID-19. And telehealth is a great way to connect patients, especially in underserved areas, with rare disease specialists. And it's an opportunity also to just kind of reduce the burden of, for instance, like traveling to a provider to seek care. And then finally, I want to talk a little bit about treatment availability. As mentioned earlier, very, very, very few treatment options for rare diseases, and even less are FDA approved. And so it's really, really important that we're advocating for the availability and affordability of treatments, including orphan drugs and other innovative therapies such as gene therapies. These can be really, really important for ensuring that patients with rare diseases are, having positive health outcomes. Next, going into research and policy. The biggest thing when it comes to research and policy is promoting data sharing and patient participation in research studies, especially when it comes to genetic research. There is a huge underrepresentation of minorities in these studies, and this can impact the efficacy of current therapies for rare diseases. And so it's really, really important that we're promoting data sharing and patient participation so that we can accelerate the development of therapies and expand upon diverse representation in treatments and in research. In addition, advocating for policies that protect the rights and interests of individuals with rare diseases is really, really important. This can include disability accommodations. So whether or not somebody is able to, for instance, use public transit or is able to navigate their school or workplace, these are all fall under disability accommodations. Health insurance coverage. So given the rarity of rare diseases, sometimes it can be really, really difficult to not only obtain good health insurance, but also get coverage from your health insurance for certain treatments and screenings and things like that. And so advocating for policies to expand health insurance coverage is really important for rare diseases. And finally, funding for research. Research is really how we're being able to develop these innovative therapies for rare diseases. And so advocating for more funding opportunities so that we can develop these treatments can really help a lot of future patients with rare diseases. And then finally, collaborating with policymakers to establish rare disease registries that can inform public health strategies and resource allocation can be really, really impactful as well. Rare disease registries are a really great resource for the rare disease community and just being able to improve upon current research in this space. And then the last thing that I want to talk about is patient and family support. This can be really, really, really meaningful for patients with rare diseases who are going through a lot of, personal challenges. Being able to seek out a support network is going to be really, really important for them. And so one way that patients can seek support is through patient advocacy groups. Patient advocacy group, such as the E.WE Foundation, is a really great resource for providing emotional support, information, and resources for rare diseases. In addition, promoting mental health and support services for the psychological and emotional challenges associated with rare diseases. Oftentimes, because of just the fear and uncertainty surrounding rare diseases, this can have a negative toll on mental health of patients and families. And so ensuring that patients are receiving not just the health care that they need and the clinical care, but also some of the mental health care is really important. And then finally, equipping patients and caregivers with the knowledge and skills to navigate the health system, advocate for their needs, and actively participate in their healthcare decisions. And so this means giving them the skills, because navigating the health system is already hard if you know the language, or you have a more common condition. But when it comes to having a rare condition, this can mean sometimes that patients are seeking out multiple different types of providers. They're going to a lot of different health institutions just to seek answers. And this can be really taxing for patients and families. And so we want to make sure that we're giving these patients the skills that they need so that they can go into these healthcare spaces and be able to advocate for their needs and make informed healthcare decisions. And so, kind of to conclude all of this, health equity for rare diseases requires a multifaceted approach that involves healthcare providers, public health practitioners, researchers, policymakers, and patient advocacy groups, as well as the broader community, in order for us to achieve this. And so, by addressing these considerations mentioned previously, it is possible to improve the quality of life and health outcomes for patients and families living with rare diseases. And so I want to just leave everyone with some great resources offered by the E.WE Foundation. The LEAP program is a community education program that focuses on providing resources and knowledge for patients and families with rare diseases, especially in terms of things like health literacy. We really want to ensure that patients are knowledgeable going into these healthcare systems. The ZEBRA program is a mental health and support program, and we have things like peer-to-peer support that patients can seek out if they need some additional mental health support. And then finally, the STRIPE program is an economic assistance program. This is a way for patients, they can seek financial assistance if needed to kind of alleviate some of the costs associated with healthcare for rare diseases. And so if you're interested, feel free to go check these programs out on the E.WE Foundation website. And so I'll just leave you all with, this is my contact information. as well as the E.WE Foundation's website. And I also want to take this opportunity to acknowledge everyone at the E.WE Foundation, especially my project mentor, Cheyenne Walmsley. She has been a really, really great mentor for me as I've been developing this health equity workshop, and I'm super excited with how it turned out. I hope you all enjoyed this course, and I'm really grateful for the E.WE Foundation for giving me this internship opportunity to participate in this. And so thank you all so much. Here's a QR code. If you'd like, you can scan this to access some additional resources for health equity and rare diseases. And so thank you all so much.
To receive the continuing education credit for this course, scan the assessment QR code on the screen. Thank you for tuning in to the E.WE Foundation's Health Equity Community Workshop. To learn more about our health equity initiatives, visit our website at www.thewefoundation.org/healthequity.